adult sinus problems is a very large and diverse group. I break it into different categories. I look at allergy, which typically is sneezing, itchy eyes, runny nose. It may be seasonal, it might be spring and fall, it might be related to allergens like pets in the house, things like that. That's always a medical problem. So we treat it with avoiding the allergens, using saline nasal spray, using intranasal steroids, using antihistamines, maybe Sudafed, and other allergy medications. Once in a while, I'll send the patient to an allergist, and they can do allergy testing, typically skin testing, but there are many different types. And occasionally, immunotherapy, which is basically shots, will be helpful for patients who have fairly difficult allergies. The second topic is obstruction, and that often requires me to put a little endoscope or a telescope in the nose to look at the anatomy. And if I see some deviation of the septum, which is in the middle of the nose, or large turbinates, which are like sausages on the side of the nose, or polyps or other things, then I can address those directly. Obstruction can be treated with breathe right nasal strips, elevating the head of the bed at night, Sudafed if that's tolerated, intranasal steroids like Flonase or Nasacort, and also saline. So there aren't a lot of magical treatments for obstruction. We just try typically saline, Flonase, Sudafed, or something like that. Surgically, I can straighten the septum, I can trim down those little sausages or turbinates, and that's a very successful way of improving breathing. The third topic is sinus, and sinus is a very broad topic. An actual bacterial sinus infection is infections of the air spaces of the face. So the cheek sinuses or the forehead or the ethmoids between the eyes, everything gets all infected because of the swelling. And then you start feeling symptoms. So our diagnosis of an acute bacterial sinus infection is based on the symptoms like pus, facial pain and pressure, obstruction or congestion, and also based on the time. If the patient has symptoms for a week or 10 days and it's getting worse, it may be a bacterial infection. And then we start bringing into the algorithm antibiotics and prednisone and other allergy medications. And then once in a while, we'll talk about imaging like CT scan, and we can talk about surgery.